So let's talk about the patient when they return to your unit with the TR band in place. They've had their heart cath, their radial access went fine, and they have a compression device in place. We'll talk later about the different compression devices that exist, but this one is made by Terumo, and this is called the TR band, which is the most common one we use in our health system. When they come from the cath lab, they'll come with a band in place on their radial artery. Make sure when you're getting handoff, you note whether or not it's the radial side, because as we discussed before, you can access the ulnar artery. But this one's on the radial side. They'll come with a splint board, which helps the patient to limit the way they move their arms so they're not at risk for bleeding. And then they come with a syringe. Now this syringe specifically is made to remove air from this band. So when you take this out, be mindful to keep this nearby, tape it to the bed rail or the patient's bed. We'll talk about the order set later on, but your assessment should be done Q15. Again, when we're doing our assessment, we want to check cap refill, which may be temporary delayed. Keep in mind, we're compressing an artery here. Are you able to feel me touching you? Yeah. Patient has good sensation, no numbness, no tingling. Any concerns for numbness, tingling, or poor circulation, you should escalate to the provider. When you receive this patient, you want to make note. Just turn the arm over, make sure you're not noting any swelling. Again, our biggest risk with accessing an artery is the risk of developing a hematoma. You want to make sure that the site is soft to touch, it's not hard, and there's no swelling noted, especially up here above and below the band. Once you've assessed your patient's arm and you reapply the straps, you want to make sure your straps are not too tight. Make note of how tight it is right here. If a hematoma develops later on down the line, this will help you gauge whether or not the site is swelling or not.